Hello, everyone. My name is Kevin, and I work at Center of Balance, based in Dinsdale, Hamilton. And I am one of the acupuncturists here. I am doing a live chat today, actually this afternoon, because I already did one in the morning. This time I'm doing a live chat on chest tightness. So today we're going to have a look at chest tightness from the Western medicine's perspective and also from the Chinese medicine's perspective. Hopefully this session will give you some ideas of how Chinese medicine we look at the issue of chest tightness. Okay, let's get started. So chest tightness from a modern medicine's perspective is that chest tightness and chest pain is a very common symptom and can have many causes. It may be a mild symptom or a symptom of serious disease, such as heart disease, for example, myocardial infarction, angina, aortic dissection, pericarditis, myocarditis, etc. And there's even the possibility to cause death when it is severe. Because the lung is also situated in the chest area, it may be also to do with lung. For example, lung diseases such as pulmonary embolism, pneumonia, bronchitis, tuberculosis, lung cancer, just to name a few. When gastrointestinal diseases such as gastroesophageal reflux, peptic ulcer, biliary, and pancreatic disease occurs, there may also be chest tightness and chest pain. Some people have contusions, for example, physical injury trauma, causing chest muscle strain, rib trauma, or costochondritis, fibromyalgia, so scoliosis can also cause chest tightness. Chest tightness can also occur when infected with shingles. Many times, chest pain is caused by psychological factors as well, such as anxiety disorder, depression can also cause chest pain. Chest tightness often classified as autonomic disorder as well. There are many types of this pain, which may be the symptoms might range from a tingling sensation to tenderness to dull pain and burning sensation. If it is chest pain caused by cardiovascular disease, it may even be transferred to the neck, chin, shoulder, back, and so on. In most cases, chest pain is not related to heart disease. Statistics from United States suggest that 6 million people goes to emergency department every year because of chest pain, which makes it the second most common symptom for ER or emergency room visits. But heart-related problems only accounted for 12 to 15%. Therefore, the vast majority of people who have chest tightness and chest pain, most of them cannot find the cause when they go to the hospital for examination, such as doing an X-ray. This is when traditional Chinese medicine theory might be able to help and explain some of the reasons why people experience chest tightness and pain. So, looking at chest tightness from the perspective of Chinese medicine, chest tightness or chest pain is definitely a symptom that has plagued the Chinese for thousands of years. The triple warmer or sanjiao can be divided into three sections. So the top part, middle part, which is the top part is more in the heart and lung area. The middle jiao is more to do with the stomach and spleen and the liver, and the lower jiao is more to do with the kidneys, bladder, and large intestines. Okay, so chest tightness belongs to the upper jiao area. In the upper jaw, there exist the heart and lungs, as I said. So traditional Chinese medicine believes that chest tightness and pain is a symptom of cardiopulmonary disease, because chest pain is commonly seen in heart disease. So in the old days, chest pain is almost seen as heart pain. The knowledge in body anatomy is very limited in Chinese medicine in the old days. Sometimes people will confuse stomach pain with chest pain. In fact, Chinese medicine separates chest tightness and chest pain into two symptoms. Chest tightness can be said to be a milder symptom. Chest distension is more severe, and chest pain is more serious. As with other pains, the easiest way to discuss chest tightness is to look at which meridian leads to the chest area. So the human body consists of 12 meridians, plus the 8 extraordinary meridians. As long as there is an abnormality in one meridian, there is a possibility to develop symptoms of chest tightness and chest pain. So let's have a look at the first scenario. Okay, so the hand 3 in meridians. Oh, sorry, not yet. So let's have a look at what are the meridians that can cause problems. So first of all, the hand 3 in meridians. So these are the lung meridian, okay, starting on the side of the thumb and travels along the inner part of the arm, okay, and ends up in the chest area. And then you have the pericardium meridian, which starts from the inner, the ring finger, and travels up on the middle of the inner side of the arm, and also to the chest area. Sorry, that was the tip of the finger, not the ring finger. It's actually the tip of the finger. That's the pericardium meridian where it starts, okay? So it travels to the center of the arm and into the chest area and ends up in the middle of the chest. And then you have the heart meridian, which travels from the inner side of the pinky and also, again, on the inner side of the arm, travels to the heart area as well. So that's the 3 in meridians. And then you have the 3 in meridians. So all runs from the inside of the hand, traveling to the chest area. The hand San Yang meridian, the 3 Yang meridian, which are on the outside, which are the large intestine meridian, running from the index finger, the hand Shaoyang Sanjiao meridian. So the Sanjiao meridian travels from the inner side of from this is the one I got confused, from the outer side of the ring finger, and the small intestine meridian, which travels from the outside of the pinky, okay? And they appear to be traveling from the outside of the hand to the neck and head, okay? Okay, so they appear to be traveling from the outside of the arm to the neck area and the head area. But in essence, it still goes to the front of the chest and down to the abdomen. The large intestine meridian has a branch that connects to the lung meridian, which eventually reaches to the large intestine. The Sanjiao meridian travels from the shoulder. Okay, so the Sanjiao meridian, the Sanjiao meridian travels from the shoulder into the chirpin, and then spread into the chest area, into the middle, okay? And the small intestine meridian passes from the shoulder Okay, so small intestine meridians on the back, and into Chepin as well. Chepin is this point just right behind your your clavicle bone. Okay. Then also travels to the heart from the Chepin area. Okay. And then it travels along the throat and to the stomach and small intestine. The rim, which is the rim meridian at the front, also leads to the middle of the chest. The foot 3 ing meridian, the spleen, liver, and kidney meridians. Spleen, okay, so the spleen, which is on the inner side of the foot, travels up. The liver meridian runs from the inner side of the big toe, travels up also. And the kidney meridian, which is travels from the sole of the foot up all the way on the inner side of the thigh as well. Okay, so these are the 3 foot ing meridians. Okay, and then you have the 3 foot yang meridians, which are on the outside. I won't go into too much details, otherwise it take too long. Okay, so it travels on the outside of the foot, on the outside of the leg, and travels all the way up the body into the head. So the 3 foot yang meridian, you have the stomach, gallbladder, and bladder meridian. Okay, so it's the stomach and gallbladder and rim. Rim is the meridian at the back, so along the spine. So the rim meridian is right in the center. Okay, so the stomach, gallbladder, and rim meridian all leads to the chest as well. As for the bladder meridian and the du meridian, which is at the front, at the back, seem to be completely located to the back of the. But if qi and blood are stagnated, the symptoms can also show at the front of the chest. So if you have so for example, if the bladder meridian at the back, which are next to your spine, just next to the spine, if they have any stagnation of qi or blood in the upper back area, then you can actually feel chest pain or chest tightness as well. So remember that. The most obvious is the du meridian on the spine at the back. If there's a lack of qi or blood causing scoliosis, so the spine not upright, so it's like this, S-shaped. Even modern medicine knows that this can actually lead to chest tightness as well. So in the following, I'll actually give you some scenarios of what can actually go wrong in these meridians. So the first scenario is abnormality in the heart and pericardium meridians. So the most obvious connection is probably the chest pain and tightness caused by stagnation in the heart and pericardium meridians. Okay, this is very easy to understand. Because the meridians leading to the chest is deficient in qi and blood. If the meridians leading to the chest is deficient in qi and blood, then there must be some symptoms because something is not flowing right. However, this cannot be observed from the X-rays examination. Yeah, if you look at the X-rays, you cannot find anything wrong. So traditional Chinese medicine does not use computer instruments to diagnose, but purely through observation of the meridian system to get to the same conclusion. The most common traditional Chinese medicine diagnosis will be weak heart qi, or coldness, congealing and causing stagnation, or heart and blood stasis, causing chest tightness and pain. So I've covered heart and pericardium meridian, so abnormality in these two meridians. And the second scenario is abnormality in the hand 3 yang meridian, so on the yang side. Okay, the 3 meridians on the yang side, or qi and blood stagnation in the chest. So the 3 hand yang meridians are closely related to the chest tightness and chest pain as well. The most common being the sanjiao and large intestine meridian causing chest pain. If a person's chest is injured or by physical trauma or bruised, or the meridian in the chest area are abnormal for an extended period of time, these reasons can all contribute to chest qi and blood stagnation. So when qi and blood are not flowing properly through the chest area, it will result in the feeling of chest tightness, chest pain, feverish sensation in the chest, and thirst and dry mouth. The traditional Chinese medicine's response to chest tightness and chest pain is usually to use medicine for external trauma and injury. This type of chest pain usually feels stingy, based on the principle after removing the chest the qi and blood stasis in the chest, the qi and blood can flow unobstructed. And this method has been used clinically with good effects for thousands of years as well. The next scenario is liver qi stagnation. So all autonomic disorders, panic disorders, anxiety disorders, or bipolar can cause chest tightness and chest pain. And they are often associated with liver qi stagnation. In Chinese medicine, the liver is associated primarily with emotion of anger. When there is qi stagnation in the liver meridian, it often causes irritability, depression, anger, stress. This is because liver qi stagnation can turn into fire. And when the liver fire flares up, it can affect the spirit or the shen in the heart. Furthermore, liver also governs tendons, and therefore if the liver is imbalanced, it can also cause inflexibility and makes the tendon to become malnourished and become tight. Hence, you can also feel tightness around the body, in the shoulder area, or even in the chest area. So in the next part, I want to give you some things some acupoints that you can use at home to alleviate your chest tightness or chest pain. So one of the most commonly used point in Chinese medicine is called 外观. Okay, 外观 is roughly around 3 fingers width from your wrist and in the center of the external part of your arm. And you should be able to feel there's a tendon here, and actually the point is right in between of the 2 tendons. Okay, so there, you should feel like there's quite a bit of a depression. You can push quite deeply, and if you massage that area, it tends to alleviate your chest pain and chest tightness. Okay, so each time you can use a massage tool, or you can use your finger or thumb. Each time massage for about 30 seconds to a minute. Okay. All right, and see if that helps you. The next point is called 内观. So 外观 is on the outside, and 内观 is on the inside. So 内观 is very easy to locate as well. So it's about 3 fingers width from the inner part of your arm, your forearm, just from the wrist. Okay. So it's also located in the middle between the 2 tendons. So give that a good rub. So press down and rub it for about 30 seconds to a minute. And you should be able to feel a little bit sore in that area as well. Okay, so these 2 points are very good for alleviating your chest tightness. And another point I can teach you is called 使则. 使则 is actually where your arm, okay, I'll show you this. If you fold your arm this way, you should be able to feel a tendon right in the middle. And the point you want is actually on the external side, on towards your thumb, okay? So there should be a depression area, if you can push down quite far, right next to the tendon on your thumb side, okay? So you can push down and give that a rub. That point is called 尺泽. It's more to do with your lung system. So you can use this to treat any tightness or tension or pain that's in the chest area that is associated with your lung. Okay. And that's it. I hope you guys benefited from this session and got some ideas of what Chinese medicine thinks about chest tightness or chest pain. And if you have any questions, please leave a comment in the section below, or you can call us directly. And our number is 07846 7956. And I look forward to hearing from you or seeing you in person. And so this is Kevin from Central Balance. We're based in Dinsdale, Hamilton. Please don't hesitate to refer any patients that you think might benefit from our treatment, or even yourself if you have any problems. We're really happy to help you. Thank you. Bye.